we're here to do the exam on the adolescent or child 18 and under. This is my patient. I'm Heidi Voss. We're going to start with head, ears, eyes, nose, and throat. We're going to be inspecting the head, looking at hair, skin, face. We're going to palpate sinuses, check for any tenderness in the sinus area. We can look at cranial nerves 5 and 7. See if, does that feel the same on both sides? Okay. Can you puff out your cheeks? Good. And raise your eyebrows? Okay. We're going to be looking at eyes. Eyes we're going to be looking at for a red reflex. We're going to be looking at disc size. We are going to be looking in each eye. Look straight ahead. And then we're going to look at pupil reaction, so look right at me. Good. I'm going to have you look straight at me and look over here. And over here. Good. For the eye exam, we're also going to do a Ishihara's, which is color blindness testing. We're going to do a Snellen chart, which is the basic test for 20/20 vision for all of them. Nose, we're going to examine the nose. You're just going to look in the nares for patency. You're going to look for any polyps, any abnormalities that you may see in there, maybe a Lego. You're going to look in the ears. Each ear, you're going to look in, you're going to pull up gently, you're going to look at the color, you're going to look for cerumen, you're going to look for signs of an ear infection in the younger kids especially. You want the opaque eardrum, pearly, kind of shiny, and you're going to check both ears. Along with that, you can do the Weber-Rhine test for hearing. You're going to take your tuning fork, you're going to tap it, and see if they hear the noise equally on both sides, or you can do it closer to here. You can do it on each side of the ear, and then you put it on the mastoid, see if they hear. And you do the same on the other side. We're going to look at the mouth, look for the mucosa, the moisture, the tongue, especially in kids, you're going to look for the size of the tonsils. They're graded, +2, 3, 4. You're going to look at the uvula, make sure it's intact, it's moving, the condition of the teeth. Go ahead and do that, and open up. Say ah. And the uvula, when you do that, should move up and down. That's cranial 12, 10, and 9. There should also be able to move your tongue. So go ahead and stick your tongue out at me. Good. And back in. Good. When you're looking at neck, you're going to be looking at their lymph nodes. So you're going to palpate their lymph nodes. And here, you're going to check for an enlargement. You're going to look for any tenderness. Cranial nerve 11, you're going to auscultate the carotids. You're going to listen for the pulse, the bruit or a thrill. And then for range of motion of the neck, you can just have them look that way. Push with your chin against my hand, like you're going to turn your head. There you go. And the same the other way. Push. Good. And side to side with your neck. And that way. Turn. Look that way. Good. And look this way. Good. Next, we're going to look at the respiratory system. We're going to be inspecting the skin, looking for any difficulties breathing. You're going to look at development in the younger teenagers to see where they're at. You're going to look for symmetry with rise and fall of the chest with each inspiration, expiration. You're going to palpate nodes. It might be difficult on the younger kid, but they're under the axilla, and then they're right here on the supraclavicular area. You're also going to find nodes there. You can percuss with respirations. You're going to listen for a dullness or a high-pitched noise with percussion. You're also going to auscultate all areas. You're You're going to auscultate for the bronchial area, which is right up in here. Bronchovesicular is the upper part. And vesicular is down lower, mostly on the side. You're going to auscultate the same exact areas on the back as well. Deep breath. Take a deep breath in. Again. And again. Good. Next, we're going to move on to cardiac. You're going to be looking at rate rhythm. You're going to be checking for murmurs, bruits. We're going to be auscultating on, for cardiac, you're going to auscultate the right base, the left base,